Hello, my friend. Let me ask you something important but often overlooked. How is your bowel doing lately? Have you noticed any changes in your bathroom habits? Are you feeling more tired than usual? Or maybe just not quite yourself? Today, we're going to talk about something that can truly save lives. The early warning signs of bowel cancer, also known as colorectal cancer. Now, I know it's not the easiest topic to bring up, but here's the truth. Colorectal cancer is the third most common cancer in the United States and the second deadliest. But here's the good news. It's also one of the most preventable and treatable cancers if caught early. So in this video, we're going to cover two essential things. 1. The 7 symptoms you should never ignore. 2. Simple ways to protect your colon health and reduce your risk. If you're over 60, this information is especially important. So grab a cup of tea, make yourself comfortable, and let's take care of your health together because you deserve to live fully, freely, and with peace of mind. Let's start with a simple question. What exactly is colorectal cancer? Colorectal cancer, sometimes called bowel cancer, starts in the large intestine or rectum, which are the final parts of your digestive system. This cancer usually begins as small, non-cancerous growths called polyps. Over time, some of these polyps can turn into cancer if they're not removed. Now, here's something many people don't realize. In its early stages, colorectal cancer often has no symptoms at all. You can feel perfectly fine and still have something serious going on. That's why regular screening and paying attention to your body are so important, especially as we get older. Here's what you need to know. Colorectal cancer is the third most common cancer in both men and women in the US. It's also the second leading cause of cancer-related deaths. But the good news? When caught early, it's highly treatable and often curable. That's why this conversation matters, not to scare you, but to empower you. You see, the colon is like a silent partner in your health. It works hard every day to process food, absorb nutrients, and eliminate waste. When something changes, like your bowel habits, energy levels, or weight, it's often your colon trying to tell you something, so let's learn to listen. Up next, I'll walk you through 7 important symptoms that can be early warning signs of bowel cancer. Some of them might surprise you, but knowing what to look for could make all the difference. Let's take a closer look. Symptom number 1, changes in bowel habits. Let's begin with one of the most common and often overlooked early warning signs of colorectal cancer: changes in your bowel habits. Now, this doesn't mean the occasional upset stomach or a day when things feel off. We all have those days. But if you've noticed persistent changes, that's when it's time to pay attention. Ask yourself, are you going to the bathroom more often than usual, or perhaps less often than before? Have your stools changed in consistency, becoming looser, harder, or even pencil thin? One of the most concerning patterns is when someone alternates between diarrhea and constipation, especially if it lasts more than a few days without an obvious reason, like a new food or medication. Your bowel has its own natural rhythm, and you know your body best. Some people go once a day, others every other day. What matters is your normal and whether something has changed without explanation. Here's something you might not expect. Studies show that around 65% of people with bowel cancer notice a change in their bowel habits at some point, and these changes can depend on where the tumor is inside the colon. If it's on the right side, your stool may become looser or darker. On the left side, you might experience more constipation or a sense of incomplete emptying. The bottom line, if your bowel habits are different and stay different for more than a few weeks, don't ignore it. It doesn't always mean cancer, but it does mean it's worth talking to your doctor. Symptom number 2, blood in the stool. Now let's talk about a symptom that many people feel too embarrassed to mention, but it's one of the most important signs to watch for: blood in your stool. First, let's be clear, not all blood in the stool means cancer. There are many possible causes, like hemorrhoids, small tears, called fissures, or even something you ate like beets or red-colored foods. But here's the key. If you see blood more than once, or it keeps coming back, it needs to be checked. There are two main types of bleeding you might notice. 1. Bright red blood. This often shows up on the toilet paper, on the surface of the stool, or dripping into the toilet bowl. It usually comes from the lower part of the colon, or rectum. 2. Dark, tar-like stool, called melena. This type of blood is digested as it moves through your system. It often comes from higher up in the colon, and it may have a strong, unpleasant odor. The stool may appear almost black and sticky. So what causes bleeding in colorectal cancer? The tumor might irritate or ulcerate the lining of the bowel. It could damage tiny blood vessels as it grows, or straining during a bowel movement may increase pressure on the area and lead to bleeding. You might also notice changes in stool color without obvious blood. In this case, doctors can do a simple stool test to check for hidden, occult blood. Here's what matters most. Don't assume it's just hemorrhoids. Many people delay seeing a doctor because they think bleeding is normal for them. But even if you've had hemorrhoids for years, it's still wise to get new bleeding checked, especially if you're over 60. Remember, it's better to have peace of mind than to miss something serious. Symptom number 3, abdominal pain. Let's talk now about something many people brush off or try to manage on their own. Abdominal pain. Now, occasional stomach discomfort is common, especially as we age. Sometimes it's just gas, something we ate, or changes in routine. But when pain becomes frequent, crampy, or doesn't go away, it's time to pause and listen to your body. So what kind of pain are we talking about? Cramping that comes and goes, often in the lower abdomen. A sensation of fullness or pressure, even after a small meal. Or pain during bowel movements, especially if it feels new or unusual. This can happen when a tumor starts to block part of the bowel, making it harder for waste and gas to pass through. The result? More pressure, more bloating, and more discomfort. Here's something to think about. If your diet hasn't changed, you haven't added extra fiber, and you're still experiencing discomfort or unusual cramps, don't ignore it. It's also important to mention where the pain is. Pain on the left side of your belly, especially if it's paired with changes in bowel habits or blood in the stool, may be especially worth checking out. And remember, sometimes this pain isn't sharp or sudden. It can be dull, nagging, or simply something that doesn't feel right. The good news is, most abdominal pain is not cancer. But when it's persistent, especially with other symptoms, it's better to check it sooner than later. Symptom number 4, unexplained fatigue and tiredness. Now, we all feel tired from time to time, especially if we've had a rough night's sleep, a big day, or are simply getting older. But what we're talking about here is a deeper, lasting kind of fatigue. The kind that sticks around for weeks, no matter how much you rest. This kind of tiredness can be a subtle warning sign of colorectal cancer. Here's why. A tumor in the bowel can slowly bleed over time, causing iron deficiency anemia, a condition where your body doesn't have enough red blood cells to carry oxygen. You may feel weak, lightheaded, or short of breath, even with mild activity. Cancer cells also use a lot of your body's energy to grow and divide, leaving less energy for everything else. Some people describe it as tired in the bones. They're eating well, getting rest, but still feel drained, foggy, or unusually sluggish. If this sounds familiar, and especially if it's combined with other symptoms like weight loss or changes in your bowel habits, it's worth a conversation with your doctor. Remember, fatigue is a common symptom in many conditions, not just cancer, but when it doesn't have a clear cause or it's lasting longer than usual, don't just chalk it up to aging. Your energy is valuable, and if something's off, you deserve to know why. Symptom number 5, bloating and abdominal swelling. Let's talk now about a feeling many of us know all too well, bloating. Sometimes it's caused by what we eat, beans, cabbage, or too much soda. Other times, it can signal something more serious going on in the gut. In the case of colorectal cancer, bloating or abdominal swelling can happen when a tumor begins to partially block the bowel. This can lead to a buildup of gas, stool, or even fluid. The result, that uncomfortable, full feeling like your belly is stretched or tight even when you haven't eaten much. Some people also describe colicky pain, where the bloating comes in waves along with gurgling or pressure. What makes this symptom tricky is that it can feel just like normal indigestion. But if you're noticing bloating more often, or it feels different from your usual digestive issues, it's worth checking out, especially if it comes along with changes in bowel habits, weight loss, or fatigue. It might be nothing, but it might be something, and your health is always worth the extra attention. Symptom number 6, unexplained weight loss. Now, some people try hard to lose a few pounds, especially after the holidays. But when weight starts dropping without trying, it can be a red flag worth noticing. Unexplained weight loss means you're losing weight even though you're not dieting, you're not exercising more, and you haven't made any big changes in your routine. So why would colorectal cancer cause this? Here are a few possible reasons. A tumor can interfere with how your body absorbs nutrients and calories, almost like a blockage in the system. It can also produce substances called cytokines that reduce your appetite and increase metabolism. In simple terms, your body burns more energy but takes in less. Some tumors can even cause nausea or digestive discomfort, which makes you eat less without realizing it. If you've noticed that your clothes are fitting looser, or your weight has dropped by more than 5 or 10 pounds in a short time, and there's no clear reason, that's something to bring up with your doctor. Now, weight loss can come from many things: stress, thyroid issues, even dental problems. But when it happens alongside other symptoms like fatigue, bowel changes, or bloating, it becomes more important to investigate. Symptom number 7, the feeling of incomplete evacuation, tenesmus. Have you ever gone to the bathroom and felt like you still weren't done? Like something's still there, even though you just had a bowel movement? That feeling has a name, tenesmus, and it's one of the lesser-known symptoms of colorectal cancer. Now, of course, many things can cause this sensation: a little constipation, hemorrhoids, or even stress. But if that incomplete feeling happens often or is new for you, it may be a sign that something is physically blocking the bowel. Here's what can happen. A tumor in the rectum or lower colon may press on the bowel wall, making it feel like there's stool left inside, even when there isn't. In some cases, the shape of the stool can also change. It may become thinner, almost ribbon-like, because it's being squeezed through a narrow space. That's why it's so important to notice patterns. If you're always feeling the need to go back to the toilet, or your bowel movements just don't feel complete, it's time to talk to your doctor. Again, this symptom alone doesn't mean cancer, but when it appears with other signs, like blood, bloating, or weight loss, it deserves attention. And here's something else that's important to remember. Many people with early-stage colon cancer have no symptoms at all. That's why screening is such a powerful tool. Polyps and how colon cancer develops. Let's take a moment to talk about how colorectal cancer usually begins, because understanding the process can help you prevent it. Most colorectal cancers start as small, non-cancerous growths called polyps. These little bumps form on the lining of the colon or rectum. Now here's the key. Most polyps are harmless, but over time, about 10 years or more, some polyps can slowly turn into cancer if they aren't found and removed. That's why routine screenings like colonoscopy are so valuable. They don't just find cancer, they find polyps before they become cancer. You might think of it this way: catching a polyp early is like catching a spark before it becomes a fire. Some people are more likely to develop polyps due to age, family, history, or conditions like inflammatory bowel disease. But even without those risks, polyps can form silently. The good news? Removing a polyp is quick and painless during a colonoscopy, and it could literally save your life. So remember, colon cancer doesn't usually appear out of nowhere. It develops slowly, and that gives us a chance to catch it early and stop it in its tracks. Risk factors you can't control. First, let's talk about the things that aren't your fault. The risk factors we can't control, but should still be aware of. These include age. The risk of colorectal cancer increases after age 50 and continues to rise as we get older. That's why screening is so important, especially past 16. Family history. If a parent, sibling, or close relative has had colorectal cancer, your risk is higher. It's worth telling your doctor about your family history, even if it was years ago. Genetics. Certain inherited conditions, like Lynch syndrome or familial adenomatous polyposis, can increase your risk. These are rare but important to know. About height. Believe it or not, taller people may have a slightly higher risk of colon cancer. While we don't fully understand why, it's one of those factors that just reminds us to stay alert. None of these things are within your control, but being aware of them helps you and your doctor decide when to start screening and how closely to monitor your health. Now let's shift to what you can control, and here's where your actions really matter. Risk factors you can control. Here's the good news. Many of the biggest risk factors for colon cancer come down to lifestyle choices, and every small change helps. Let's take a look. Smoking. Cigarettes don't just affect the lungs, they increase cancer risk in the colon, stomach, bladder, and more. Alcohol. Frequent drinking, especially in large amounts, can raise your risk. Cutting back or stopping altogether makes a real difference. Sedentary lifestyle. Regular movement helps your digestion, lowers inflammation, and supports a healthy immune system. Diet. A diet high in red and processed meats like bacon, sausage, deli meats, and low in fiber is linked to higher cancer risk. On the other hand, fruits, vegetables, and whole grains help protect your colon. Obesity and belly fat. Carrying extra weight, especially around the midsection, is linked to a higher risk. Gentle movement and balanced eating can help, even in small steps. The most important thing, you don't have to be perfect. Even small shifts like walking more, eating more fiber, or quitting smoking can reduce your risk and improve how you feel every day. Why colon cancer is rising in younger people. Here's something you might not expect. Colon cancer is rising in younger adults under 50, even in their 30s and 40s, so much so that medical guidelines have changed. The recommended age for a first colonoscopy has now been lowered from 55 to 45 for people at average risk. But why is this happening? Experts believe it's related to modern lifestyle changes, more processed foods, less fiber, less physical activity, and rising rates of obesity. As someone who's lived through many changes in food, health, and society, you have a unique perspective. You can encourage your children, grandchildren, and even friends to learn from your experience. Healthy aging isn't just for you, it's a gift you pass down. By taking care of your own health and sharing what you learn, you might help someone younger get screened earlier and prevent a serious illness before it begins. Now that you know what to watch for and what increases risk, let's focus on what really matters: how to protect yourself. Here are 7 simple, powerful things you can do to help prevent colorectal cancer. 1. Drink plenty of water. Staying well hydrated helps keep your bowels moving smoothly. It reduces constipation and limits how long waste stays in your colon, which may lower cancer risk. Tip: try starting your morning with a glass of warm water. It gently wakes up your digestion. 2. Eat more fruits, vegetables, and fiber. Fiber is like a gentle broom for your intestines. It helps move things along and feeds the healthy bacteria in your gut. Aim to include things like leafy greens, berries, beans, whole grains. These foods also contain antioxidants that fight inflammation and support your immune system. 3. Cut back on red and processed meats. You don't have to give up steak forever, but try to reduce how often you eat bacon, sausages, deli meats, hot dogs. And when you do enjoy red meat, balance it with fiber-rich vegetables. 4. Add natural anti-inflammatories. Spices like turmeric and cinnamon are gentle ways to reduce inflammation in the body. Use them in teas, soups, or sprinkled on roasted vegetables. 5. Include dairy if you tolerate it. Surprisingly, milk, yogurt, and cheese may actually protect against colon cancer. Just choose options that work for your digestion. If you're lactose intolerant, try lactose-free or plant-based versions fortified with calcium. 6. Move your body. Even gentle exercise like a daily walk or chair yoga can support digestion, balance hormones, and lower cancer risk. Consistency matters more than intensity. Do what feels good for your body. 7. Get screened. If you're over 45, or especially over 60, talk to your doctor about a stool test for hidden blood, or a colonoscopy, which can find and remove polyps before they become cancer. Screening isn't about fear, it's about freedom. Knowing you're clear brings peace of mind. What a colonoscopy is like. If you've never had a colonoscopy, you might feel a little nervous about the idea. That's perfectly normal. But let me reassure you, the test itself is simple, painless, and over before you know it. Here's how. It works. Before the exam, you'll need to clean out your colon. This usually involves drinking a special solution the day before and making several trips to the bathroom. Yes, it's the least fun part, but it's necessary for the doctor to get a clear view. On the day of the procedure, you'll be given a light sedative to help you relax and stay comfortable. The doctor then gently inserts a thin, flexible tube with a tiny camera through your rectum to look at the inside of your colon. If they find a polyp, they can often remove it right then and there before it ever has a chance to turn into cancer. The whole thing usually takes 30 to 60 minutes. And most people say they don't remember much afterward. Most importantly, this one test could save your life. So let's bring it all together. Your colon health matters, not just for preventing cancer, but for your comfort, your energy, and your peace of mind. Today, you've learned the 7 key symptoms to watch out for, what risk factors to be aware of, and simple, powerful steps you can take to protect yourself. Remember, colorectal cancer is often silent at first, but very treatable when caught early. You don't have to make all the changes overnight. Just choose one small step to start. Maybe more water, a walk after lunch, or scheduling a screening, because every step toward better health is a step toward a better life. You deserve that. If you found this video helpful, please subscribe to Timeless Wisdom. We're here every week with trusted advice for healthy aging, inside and out. Comment below and share with us. Have you or someone you love ever had a colonoscopy? What was the experience like? Your story could help someone else.